Welcome to Arcadia Physiotherapy. This video will show you some strengthening exercises to reduce abdominal separation. The muscles of the abdomen work to translate load across your body. The one muscle that we all seem concerned about is the rectus abdominis, the six-pack muscle, but actually all that does is sit-ups. Your waist is created by your oblique muscles and your transverse abdominis muscle, and these run side to side and diagonally across your tummy. So to strengthen them and therefore close the gap, we need to do rotational work. Lie down comfortably on the floor, with or without a pillow to support your head. Take a light weight, 1 or 2 kilograms, and hold it in one arm straight above your chest. Slowly let the arm drop out to the side, maintaining your body where it is, so not letting the body roll or twist. You should feel some work in your abdominal muscles to steady yourself as the weight moves outwards and back inwards again. You will of course find that the arm is doing some work, but try and avoid that rolling using your abdominals. This should work the muscles at the side of your abdominal wall, as the load is transferred across your abdomen as you move the weight out to the opposite side. If you find this too easy and you're not feeling any work in your abdominal muscles, simply up the weight slightly by a kilo at a time. If you're finding it too hard, you can shorten your arm, so bend it slightly and continue the movement, shortening the lever and making it slightly easier for yourself. Do 10 to 15 repetitions each side, nice and slow and steady. The second exercise is for the lower abdominals. It's important that you don't arch your back when you're doing this, keeping it flat to the floor. Holding the weight centrally above your chest, let it relax over your head and then settle your back in a comfortable position. You may find a pulling in your arms, but only go as far as you feel comfortable without arching your back. Take a breath in, and as you breathe out, pull the weight down towards your hips. Breathe in and raise it over your head again, and then breathe out, engage those tummy muscles and bring the weight over your hips. You should feel this in the lower belly, so targeting the lower abdominal muscles if this is an area of concern for you. As long as you don't hold your breath, then this should be pelvic floor safe and prolapse safe, making sure you do your effort on the exhale. You can see in this video breathing in and breathing out as you lift the weight. Breathing in and breathing out. Make sure you don't arch your back. The third exercise is rotational twists. The positioning is important as well. Don't let your knees knock in, keep your feet about hip width apart and don't let your knees touch. So in the same position, knees bent, lying flat on the floor, not arching your back. Bring the weight centrally above your chest. Then keeping the pelvis where it is, not letting it roll, twist the entire upper body, including the head, towards one side, fixing the pelvis and letting the shoulders and ribs roll all the way over. Breathe in as you do this. As you breathe out, use your tummy muscles, engage them to bring your weight back up to the central line. Make sure your nose goes with you. It's very easy for just the arms to do the movement, but that's not twisting the body. Make sure the head and nose goes with the shoulders to ensure that twists through the abdomen. Breathe in as you go over the side and breathe out as you come back to the middle. Breathe in as you go over the side and breathe out as you come back to the middle. Avoid those knees knocking in. Do 15 each side, rest and repeat. Do these daily if you can, and you should see an improvement of your abdominal separation in a few weeks. Thank you for watching. Please like and share if you found it helpful.